At some point, most of us have used GPS technology to get us from point A to point B. Turn by turn, we can be guided to go just about anywhere we want to go, even in the operating room. You heard right. Navigation technology for very common procedures like hip replacements is being used in ORs across the country, and the benefits far outweigh the risks.
Total hip arthroplasty is the most successful procedure that we do in orthopedics. Whether you do the incision up through the front or the back, they all do well over time. However, if you do the incision up the front, the studies have shown that they actually get up and move quicker. It's a muscle sparing approach, and by doing it up through the front, you can do it through a very small incision and you don't operate through the muscles that you use to walk with. It gives you more stability and it gives you longer wear over time.
So how exactly does this technique work? The navigation technology uses special tracking devices that are connected to cameras. These cameras are connected to a computer that guides the surgeon within millimeters or degrees to the implant location. This helps to ensure that the new joint has the stability and range of motion needed for a successful replacement. Dr. David Miller is proficient in this technique and explains who the best candidates are for this procedure.
Just about everybody is a candidate for this procedure unless they have prior procedures about their hip. It doesn't matter how old the patient is. We know that even octarians do very well with this procedure. It has more to do with what condition the patient's in.
The pain was really bad. It had gotten so that I had retired from my career job and was working retail, and I couldn't stand in one place like for 4 hours without taking over-the-counter pain pills, 2 or 3 of them, just to get through that 4 hours. So it was a big relief to have the new hip. I quickly got back to normal activities. Within 3 to 4 weeks, I went back to my part-time job, and within 6 weeks, friends and I flew to Branson, Missouri and took in 14 shows within 7 days.
My recovery was very easy. The surgery was on a Monday. I came home on Tuesday morning. On Wednesday, I took a walk. I never used the walker after leaving the hospital. I used the cane for a few days. My current pain level is 0. It's been that way since shortly after surgery. I never think about it being a replaced hip.
What once sounded like a sci-fi storyline is now very real, and as advancements in science and computer engineering continue to merge, we can expect to find some of the most revolutionary surgical solutions at our fingertips.
I've been extremely pleased with the results. I think in the future, I'm working with engineers and helping perfect some of the techniques. I would love to see this technology available for every patient out there.
Located in Richmond, Virginia, Dr. Miller and his staff at Ortho Virginia are offering the most cutting-edge surgical options for patients in the surrounding areas. Computer-assisted navigation surgery combined with a direct anterior approach is the procedure for total hip replacement that Dr. Miller utilizes. The procedure takes about an hour, and post-surgical recovery is faster and less painful than more traditional techniques.
It gives me a computer-generated blueprint that I'm able to accurately, off of each individual patient's anatomy, determine precisely what position I need to put the components, in addition to help with accurately determining what their leg lengths should be based off of preoperative x-rays. And so therefore, overall, it's a more accurate way to do this.
I definitely would recommend this procedure to anybody that needs a hip replacement. It's made my life so much easier. I can do the things that I love, and I don't have the pain to deal with.
I can ride a bike these days. I do that occasionally just because I can now. I've gone for a run a time or two. Swimming is my preferred exercise, but I can ride horses now, walk, do anything I want to do.
There's no need to live with debilitating hip or groin pain anymore. To find out if you're a candidate for this procedure, schedule an appointment with Dr. Miller today.